With your special population clients with high blood pressure, with our resistance training, it needs to lift lower weights, lower intensity, and also just higher reps. Also, need the exercise have our clients sitting down or standing rather than lying down, as when they stand up from lying down, they'll have dizziness. With the exercise that we did, the wall push-up was a good example for a client with high blood pressure. But with the rows, I would mostly get them in a seated machine row rather than with lying down, their head down row. And then the squats will be more of a horizontal machine leg press, so they're not going down and coming up all of a sudden where they're just seated in a good position and they're just pushing with their legs out. With the exercise, I would have lower intensity walking rather than jogging. And on the cycling machine as well. Cross trainer you'd have to be careful with, because with their arms pumping there'll be a lot more blood flowing through their body, and you just have to watch them with that. But definitely walking on the treadmill and cycling will be fine. In this special population of your client with low back pain, a lot of that comes from genetic malformation to injury, but it is also mainly in regards to poor posture, which stems from lack of core strength in your abdominals and your obliques, as well as lack of strength through your lower body of your gluteus maximus as well as your quadriceps. With your resistance training, I would maybe stick away from the bodyweight push-ups, more do the wall push-ups as we did earlier, as that is not putting any stress on your back. Do assisted chin-ups I would recommend, with weights helping you come up rather than a bent over row or anything like that, which again is putting less stress on your back. And then I'd look at either doing bodyweight squats or wall squats, just to help that support of the back as well. With your cardio exercise, should be fine with walking on the treadmill. I'd watch the running on the treadmill, as that'd be a lot of jarring through your knees and then up into your back. Your cycling should be fine, maybe more stick with your sitting down recumbent cycling, and then your cross trainer should be fine as well, as there's no shock coming through the back there either. In regards to your special population with a client with knee injury, it is important to strengthen your muscles around your knee joint as well as increase their flexibility, which is also important as well. Which is your major ones are your quadriceps, your hamstrings, your adductors, abductors, as well as your gluteus maximus. With the exercise modifications, I'd mostly stick to walking on the treadmill, as there would be a lot of jarring going through the knee. Definitely stick away from running, as that will put a lot of pressure on your knees through jarring. Your cycling should be fine, either you're sitting upright or your recumbent cycling. And your cross trainer, that should be fine as well. I'd maybe stick away from the rowing machines, as that would put a lot of stress through your knees as well with the bending and the force going through them. With your resistance training, any of the sitting down exercises for your chest or lying down will be fine. It's not putting any stress on your knees, it's all going through your lower body, all going through your hips and your back. So either you're lying down chest press or 45-degree chest press or fly, that'll be fine. In regards to your back, we'll do assisted chin-ups as well. That should be fine, as there's no pressure on your knees. Rows will be different again, because you're putting a lot of pressure on your knees through the machine, and also if you're doing standing bend over rows as well. And then for your squats, I'd maybe stick towards your wall assisted squat. Stay away from lunges, as that's a lot of balance that's required through your knee joint as well, which is bad. Or there's even, if you're a bit more advanced through your recovery, I'd even maybe look at doing a box squat or a wall sit squat. And so that's it, just using your body weight, try not to use any heavy weights, and that should be fine. Alright, so what we're going to do now is just a couple of stretches, just to stretch the major muscles of that we worked today. The first one we're going to do is our pectorals major. What I want you to do is, it's easy if it's up against the pole, but all we have to work with here today is the wall. So what I'll get you to do is stand facing the wall. I'll get you to put your left arm up against the wall, and then I'll get you to slightly twist your upper body until you're feeling it stretching through the top of your pecs. And then I'll get you to hold that for 10 seconds, and then we'll do the other side. Yep, that's good. And don't forget to breathe as you're doing it as well. hamstrings. So I'll get you to sit on the floor. Get you to put your right leg out in front. Bend your left leg up to roughly around where your quadriceps thighs are. And then I'll get you to have a straight back, lean forward and reach as far as you can. See if you can touch your toes or even your shoelaces. We'll go until you just feel it starting to pull. It doesn't want to be heavy, it's just a nice gentle stretch. We'll do some 10 seconds and then we'll swap over to the other side. Alright, and then we'll swap over to the other side. Lean forward, hit that back to that. And touch your toes. Keep breathing. Hold this one for 10 seconds as well. And well done. How was those stretches? All good?
Yep.